I'm Diana Forrester. I'm the Director of Health Policy for Texans Carefor Children. I want to thank you, committee. This is a great base budget. There's a lot of great stuff in here. We're really excited that you all chose to fully fund the tiers upgrades. It's going to have a huge impact for Texas families. There's a lot of great stuff in here. Thank you so much for continuing the rural add-on payment for labor and delivery in those rural areas. I talk to the rural physicians all the time, and it's really hard for them to maintain those services, but they know how important it is, and so that add-on payment really helps them. Additionally, thank you so much for continuing to fund the mobile health units. That additional 10 million is really going to help reach more areas of the state. And I've gotten to meet some of the mobile health units that are already operating in the state, and they just have amazing stories. I mean, they're treating people that haven't had access to health care in years, sometimes decades. Additionally, thank you so much for keeping the Texas AIM rider in there. I know that the agency wanted to strike that language, and I know that you guys just updated it. So thank you so much for keeping that legislative direction in there. Additionally, I won't spend too much time on it because other people have talked about it way more, but we would love to see the funding for the women's health programs get to a better place by the end of session, and I know the intent is there, and so we look forward to that. Additionally, we would like to see the mobile health unit rider kept in there. Right now, it's stricken all the way through, and I think it would just be really good to have that legislative direction to the agency to use those funds specifically for that purpose. And additionally, we would just like to say we would love to see continued funding and additional funding for the Texas AIM program. It's a great program in our state. We're leading the nation in this, and I talk to doctors all the time across the state that are really excited about this. They've had great success stories, and a lot, especially in those rural areas. I mean, they say, like, I don't have the time to come up with this. I don't have time to come up with the policies and everything that we need to do to be prepared for these situations, and the training that I get through that program has saved people's lives. Thank you.
Senator Alvarado, do you have a question?
Thank you, Madam
Yes.
Chair. When you say get to a better place, can you explain a little bit more?
Yeah, so it's my understanding that the projections that are in the base budget are based on different numbers than what was in the HHSC LAR. And so I think there's a huge discrepancy between what was in the HHSC LAR and then what is
Can
in
you
the base budget.
elaborate on that discrepancy?
Yeah, I mean, I think it's like almost like $100 million, so it's a substantial amount of money. And I think the projections that the LBB are using is based on 2023 numbers, which were substantially lower than 2024. And so we would, as it stands right now, the way that it's in the budget, it is essentially a cut to those programs. And so we would love to see that funding kind of restored and get closer to that HHSC projection number in the LAR.
Okay, thank you for the explanation, because somebody touched on it earlier, but they didn't get to go into the full explanation. Thank you.
Thank you.